Thank you, Stefan. Hi, Anna. Thank you, you too. It's a pleasure to stay here. Um, Really, it's an honor for me to speak about dentistry. Um, Especially, I'm from Uruguay. Uruguay is a small country. And I can speak about this. Let's speak about dentistry. I know it's a special uh, medicine, uh, and let's start. First, when I start this career, I want to have a product, a standardized product, because I need to work with the same product in all the year. Okay, in autumn, in spring, in the morning, and in the evening, I need the same product. And I speak with Apitherapy, they work with some quality at the same time. They use this type of propolis, no these propolis. They use this kind of propolis, and they in the propolis, in the solution propolis, the alcoholic solution, I found this product at the same time. Especially, Uruguayan propolis institution is pinosembrin, pinovaquin, and excellent flavonoids for the antibiotic and anti-inflammatory character. This is an analysis from Basia, Vancouver. I think this the best analysis from the Uruguayan properties. Okay. And Apither makes this solution 5% solution propolis, alcohol solution propolis solution, and I use like this in a syringe, in a small syringe, and I use this kind of solution. For what? Or for with how can you use propolis in what kind of situation we use propolis? In caries, supragingival plaque. Anna is speak about this in the next. From cavity disinfection, root canal treatment, gingivitis, dental pulp. Let's see one clinical case next. Periodontitis or inflammation of the periodontic ligaments or tissue. Wound healing, of course, and bone healing. This is everything of the use of propolis in dentistry. You can find in this article we write with Felix Henry and Fernie and Munir. Okay, and let's see some clinic cases about this or the use of propolis in dentistry. First case we see about use in root canal treatment. This is a picture, my picture. It's a picture I take. Okay, this is the patients come to the office and say me about this small fistula refer to this piece. Okay. First, I think about this is a small infection, no problem, etc., etc. And when I take the RX, this is the small infection I saw in the RX. Okay, this is the infection. It's a big, big, big infection. And this is another problem. There have got another root canal treatment. Okay. Okay. I have two options: or take off the piece, or make a bone graft and then place an implant in 6 months, or take off the post. This is the post, metal post, and try to make the root canal, filling with material here, and wait the new bone formation in this place. What's the problem about this? The problem about the take off the post is they are very fragile, this part of it. If I take off this, the roots perhaps was broken, and I decided to with the patient to make this the root canal, take off this, and try to treat the infection. Okay. Okay. Take off the post and make the root canal treatment with propolis, 5% propolis, and this is a week before. You can see here there is a new bone formation, and the infection is released after a week. After 2 weeks, this is a new bone, and the infection is small too. Okay, this is the infection here, and infection small. After 3 weeks, after 4 weeks, after 4 weeks, after months, I make the root canal treatment here, filling the root canal with a pressure point, and wait to this infection is placed. 5 weeks and 6 weeks. You can see here the infection is small and the patient is happy. Me too. We make another jacket or crown, and this is still in the place. Okay. Another clinic case. This is a periodontic treatment. The patient comes to the office and show this fistula here. So here we injecting between the root and the gum propolis. Okay, in this place. You can see here. So this is the pus here. There is infection between the root and the gum, and we use propolis to fight to this. And I know it's better now. This is the gum is still better. I'm not uh, sure that I control the infection. And another application, but it's still here a problem. Okay, let's go. And what you see, I make a flap. Yes, this is the gum. I make a flap. And take a surgery here, clean this place, and here, better, and clean this place from tissue, unhealthy tissue, and use propolis, 5% propolis to prevent or for eliminate the infection. A bone, not bone graft, is a artificial bone I put and close the flap. Okay. A week after a week, and this is not a week, this is a 2-week contract. Okay, really is better. And the teeth is still in place. Okay. And another use is in operative dentistry. Operative is not surgery, it's like treatment, caries treatment, and another kind. This is a company, Hoffman, that's developed and cement about which this like with propolis. This is a hydroxyapatite cement, and this is the like it is with propolis. And when we use, if we have a big caries lesion, we eliminate a part of the caries and put this cement in the floor, okay, and wait 1 month. Okay, let's see. For what? Because the propolis stimulate
Yes. Okay. Okay, let's see. Yeah. Yeah, it was a bit slow, the connection. Yeah. Maybe we wait 1 minute for about 1 minute. And okay, Anna, you are ready to start anytime?
Yes, I am ready.
Yes.
So
yes.
if we haven't connected with Dr. Felici, I can start.
Okay, okay, let's wait a bit. Okay. Okay. Meanwhile, in this 1 minute to wait, let me tell our participants and you, I know Dr. Felitti for many years. He came also to Romania, to our Apitherapy Congress. So it is very interesting. It's spectacular to see this injection of propolis tincture of honey directly into the tooth. And there are also in the literature, we find the treatment of parodontosis, like this gum disease, parodontosis. It is also possible to inject the honey or propolis extracts between the tooth and the gum. So in that area, of course, always is needed first that the dentist makes all the treatment, all necessary treatments from the dentist point of view. And then we can come with the B products. And to prevent, it's wonderful. Propolis is wonderful for this, generally speaking, but also spectacular use. And Dr. Felitti has not tried yet, but I know a doctor here in Romania, and also in Japan it is used. These things directly in the mouth on the gums where it's an abscess or an infection, and the healing is spectacular, like 1 hour and the abscess goes down. Okay, very glad to see you again, Dr. Felitti. It was a problem, technical problem, the battery or what?
I don't know. No, my internet is go down.
Okay. Can you restart share screen and go directly to the slide, the last slide you have been? First open the PowerPoint and go to that slide and then share screen. First open the PowerPoint.
Okay. Sorry, I'm so sorry.
No problem, no problem. It happens. Yes, very good. And make full screen down. Yes, yes, there. Very good.
Okay. Thank you. It's the cement, the propolis stimulate the stem cells of the pulp. They stimulate to grow the dentin in the upper of the pulp. Okay, and we wait a month. If you can see here, this is the problem. Sorry about that. This is the pulp here. This is the cavity. And this is the caries. If I continue drilling this, I exposure the pulp in this point. And if I put some cement here with propolis, the thin cells here stimulate the dentin growing in this point. Okay, after a month, this is here, this is a bridge here, in this point, from the cavity and the pulp. You can see here is a point, is a here, and here the pulp is like a line. This is the growth of the dentin cells. And what I prefer propolis, obviously, is anti-inflammatory, anesthetic, analgesic, and stimulate these stem cells. This is one of the use of the propolis more in dentistry. In dentistry, they are the companies. Sorry. ¿Podés callar el perro, Mateo? Sorry. The companies are investigate about aggregates new components in the cement for this type of treatment. They are leverage some products to the medium, to the buccal method. Okay, one of these is this type of cement. Okay. And after a month, this is I can show. this type of denting, and the problem is out. I make the composite, and everybody is happy. I think it's much more products, more uses about propolis, about honey, about royal jelly, and other products of beehive identity. The patient is a holistic patient. We need to recommend it to take some products, some bee products for his health. And thank you so much. And of course, the questions are welcome.
Thank you very much, Dr.
You're
Felitti.
welcome.
Thank you. Thank you. Please now, yes, stop the share screen. Very, very good presentation. A spectacular presentation, as I said before. And maybe one proposal, Dr. Felitti, if you can write an article, a detailed article in Spanish and English with all the steps and the what to do, and like an article would be very good.
Okay.
Because some of the people they have difficulties to understand English, so an article would be very precious from you.
Okay.
Thank you very much. Thank you. Okay, now we can go to Anna. Anna, the floor is yours. Please start your share screen.
Welcome, everybody. Greeting from Poland. I hope you are doing well. Dear participants, I would like to present the propolis influence on the dental plaque accumulation and on dental plaque and severe acute respiratory syndrome coronavirus 2 interrelation. Dental plaque plays an important role in etiology of dental caries. It is a natural biofilm which contains live and dead bacterial cells, surrounded by extracellular water-insoluble and water-soluble glucans and glycoproteins of salivia. One of the main factors responsible for the development of dental caries is dental plaque bacteria. On this picture, you can see patient after tooth staining, after chewing a red coat containing fuchsin, we can indicate dental plaque. Long-term accumulation of dental plaque leads to tartar. On the next slide, which was made by Dr. Rafael Felitti, you can also see patient with dental plaque. Bacteria present in dental plaque leads to dental caries and periodontal disease like periodontitis and gingivitis. Bacteria present in dental plaque cause the destruction of periodontal tissue through direct and indirect mechanisms. The direct mechanism is associated with release the enzymes such as hyaluronidase, collagenase, elastase, as well as exotoxin and endotoxin, which injure the periodontal tissue. The indirect mechanism of action is associated with an activation of cytokines, inflammatory cascade, and the production of inflammatory mediators such as interleukin 1, 6, and 8, tumor necrosis factor alpha, prostaglandin 2, interferon, and C-reactive protein. Many studies indicate the relationship between oral health, inflammation, and systemic diseases. Dental biofilm, especially subgingival plaque, is associated with many various systemic diseases, especially cardiovascular diseases, diabetes mellitus, respiratory diseases, and recently also COVID-19. The inflammatory pathways are involved in systemic diseases like cardiovascular disease, hypertension, diabetes, and obesity, are the same pathways which occur in periodontal diseases. So, patients with dental plaque or periodontitis may be more likely to the development severe course of SARS-CoV-2 infection. The oral cavity contains a reservoir of respiratory pathogens which during cough may lead to development of hospital-acquired pneumonia. The dental plaque influence on severity of COVID-19 complication. Among mechanisms which explain the association between dental plaque and severity of COVID-19 complication are aspiration of oral pathogens into the lower respiratory tract, and in this way it leads to pneumonia, modification of respiratory tract mucosal surfaces, so pathogens can more adhesion to the lung epithelium, secretion of pro-inflammatory cytokines, moreover enhance expression angiotensin converting enzyme 2 receptors. People with more expression and these receptors may be more likely to develop severe course of SARS-CoV-2 infection. Impact of pro-inflammatory protein galectin 3, which increase viral attachment, increase in plasma the D-dimer amount. Propolis is a natural substance which is useful in dentistry and oral health management because it possesses antimicrobial effect, anti-adherent effect, and it inhibits also of glucosyltransferase activity. Mainly apigenin, pinosembrin, and artepilin C are responsible for antimicrobial effect. Apigenin and farnesol are responsible for anti-adherent effect, and apigenin can inhibit of glucosyltransferase activity. Some studies indicate that ethanol extract of propolis can decrease index plaque. The study of Ku showed that 3% ethanol extract of propolis decreased index plaque about 44.7%. and inhibit of insoluble polysaccharide formation about 61.7%. Moreover, rinse the mouth with propolis ethanol extract bring good effect and can reduce dental plaque. Moreover, the use of toothpaste containing propolis can prevent dental plaque formation. I would like to present a case study described by my previous speaker, Dr. Rafael Felitti. The patient was 20 years old and suffered from bulimia and anorexia, and Dr. Rafael used 5% propolis solution to fight with the dental plaque. Ethanol extract of propolis has been used after a prophylaxis once a week. Ethanol extract of propolis was used with a syringe and between the gum and the teeth, as well as over the teeth. On the picture, you can see this procedure. And you can see the result after propolis irrigation. I would like to present compounds which are responsible for antiviral action of propolis. because propolis exhibits not only antimicrobial but also antiviral action. So it can be used in treatment with COVID-19. Mainly caffeic acid, rutin, crizine, camphorol, galangin, quercetin, but also fisetin. The last study indicates that lupeol and 10-hydroxyl-2-decenoic acid, which is main fatty acid which occur in royal jelly, but it is also occur in propolis, can bring antiviral effect. So propolis have impact on preventing against coronavirus because it inhibits the activated kinase 1, artepilin C, and caffeic acid phenyl ester is responsible for this effect. Moreover, propolis can inhibit of angiotensin converting enzyme 2 receptors, and for this effect are responsible rutin, myricetin, caffeic acid, phenyl ester. So caffeic acid, rutin, crizine, camphorol, galangin, fisetin, lupeol, and 10-hydroxyl-2-decenoic acid are responsible for inhibition of viral replication. The last studies showed that liposomes containing the Egyptian propolis extract displayed the effect similar to the antiviral medicine remdesivir in terms of inhibition SARS-CoV-2 replication in vitro. So we can sum up this presentation. I would like to present some conclusion. Dental biofilm, especially subgingival plaque, has been associated with development of severe complication due to SARS-CoV-2 infection. Periodontal therapy in patients with initial COVID-19 symptoms may reduce the level of D-dimer in plasma. Keeping in good condition oral health may decrease the severity of COVID-19 symptoms and reduce the associated morbidity. Polyphenols of propolis prevent from carcinogenic bacteria and reduce the inflammatory process. Propolis is useful in dentistry and oral health care. Thank you very much for your attention.
Thank you very much, Anna. Excellent presentation, very dynamic, full of energy. You showed us that it's very important also for COVID-19 to prevent, to have a good health in the mouth. And we have a couple of more minutes, and I kindly ask the technician to put the video recording from Dr. Munir. Unfortunately, he was not able to join us like online, but we can see his presentation.
Can you see the screen sharing right now?
Okay. Not yet. It's coming. Yeah.
Okay.
Yes.
Hello, everyone. Welcome to this lecture on the use of propolis in oral healthcare and oral medicine. My name is Dr. Munir Ravalia. I work mainly in general practice, but also based at the Royal London Dental Institute. So without further ado, I know we don't have a lot of time, so I'm going to jump straight into it. So for those of you that don't know what propolis is, it's a sort of mixture of various constituents. I'm not going to go into a lot of detail because I'm sure you've heard a lot of this. But it's mainly resins, mixed in with the wax, and obviously it has these various flavonoids, bioflavonoids, amino acids, vitamins, which have very strong, useful antibacterial, anti-inflammatory mediators, which are very useful, obviously, not just in dentistry, but for the general improvement and well-being and prevention of a lot of diseases that we encounter generally as human beings. And we know that the bees utilize it themselves for their own protection. So we've been utilizing it clinically in patients with a very good success rate. Now, in terms of the way it works, it sort of seals it seals, physically can seal and wrap bacteria, viruses, fungi, and therefore allowing the body's own immune system and defense system to kick in and defeat these bugs. And as noted, it has very high antifungal effects, which is very useful in fungal infections of the mouth as well. The flavonoids are very important because they stimulate white blood cells and lymphocytes. Obviously useful and important to maintain a strong, healthy immune function, but also useful and important in fighting off if someone does become in a state of inequilibrium. So it can be utilized again systemically and topically for dental and other medical uses. Various studies conducted, studies have been conducted a long time ago, so this is nothing new, but they found that the dilution of propolis inhibited the growth of Staph aureus, and very useful in hospital environments where there's MRSA strains that have become resistant. But essentially important to realize that the way propolis works, there's no single ingredient that is generally predominantly active, and therefore they all work together synergistically, and therefore that's why it is such a great holistic product to be used in the care of humans, and obviously in animals it can be used as well. So obviously in dentistry there are multiple ways it can be used, from the more sort of mundane treatment of aphthous ulceration to more acute symptoms patients may feel from erupting wisdom teeth, pericoronitis, erupting deciduous children's teeth. But you can move on to use it in the application of root canal therapy, again, because of its antimicrobial and large anti-inflammatory effects. It's very useful in sort of calming down the nerve chamber, the pulp of the tooth, which gives, again, a lot of symptomatic relief for the patient, which is very, very important. Because of its antifungal properties in angular cheilitis in the corners of the mouth, someone's facing that, very useful in actually curing the problem, because a lot of patients that don't get this treated correctly have this as a chronic recurrent infection, which is debilitating because it gives them pain, crustaceans in the corners of the lips, and causes general problems for them. It can again be used in general dentistry for in addition to maybe other temporary restoration and dressing materials, again bringing back anti-inflammatory aids with that. But more importantly, there are studies and quite a lot of work being done in its use in periodontitis. So the initial stages of gum disease is you get gingivitis, inflammation of the gingival tissues, surrounding tissues around the teeth. And then this progresses to periodontitis, which is basically an inflammation of the bone, and it get a destruction of the bone. So it's been a lot of studies showing how useful it is in periodontal disease. And I've just included one study at the bottom here, but there are hundreds out there actually. And this is a Professor Chappell in the Journal of Molecular Pathology, again, many years ago, actually, when I qualified in 2002, showing it's a very powerful antioxidant and can be utilized very usefully in the management of periodontitis. Not as a sole agent, obviously the patient still needs additional dental treatment, but it's been shown to enhance and reduce the timing and improve the healing for patients who suffer from this type of advanced gum disease. Now, again, research, I've put some very old studies because I want people to realize that this is nothing new. Studies from the 80s and 90s, from globally, a lot of great work done by our colleagues in Eastern Europe, Romania, Yugoslavia, and even Russia, showing again how useful propolis is in oral disease, gingivitis and periodontal disease, but again, also how it can be used as a pulp capping agent and assist in root canal filling. So people are more than welcome to search for these online, and you'll find many of these studies. Sorry about this, is slightly blurry, but this is a book written by a colleague. We all know James Fernley, active in the apitherapy world, and Dr. Philip Wanda, and him, which I'm updating at the moment, produced this lovely little booklet, Propolis in All Healthcare, and it sort of goes through different case studies of patients who they've treated, and shows how you can use this not only topically, but can be used very usefully systemically as well, to boost up the patient's immunity. Because a lot of times we see patients who are suffering from oral disease, their immunity is dropped. So if we improve and enhance that, it really makes a massive difference in the outcome of their oral conditions. So if we look at some case studies now, traumatic ulcers. The problem in the mouth is because it's such a moist environment that a lot of the general tinctures or the general previous solutions for such things were very haphazard, because they didn't stick to the mucosa. Whereas something like propolis, if you look on the bottom right, you can see it actually sticks to it's sticking to the tongue. So, you know, the patients get immediate sealing of the area, which enhances and reduces the pain they get. And then ultimately, because of that sealing, helps and aids, as we know, the multiple functions of propolis and its properties, assists in the speedy healing of such painful sites in the mouth. Again, you can see this very raw ulcer, this ulceration on the left-hand side. And again, one of the great properties of propolis is that it's analgesic. So we find a lot of times when it's used for ulceration or even pericoronitis, it stays in the area and gives this analgesic effect and anti-inflammatory effect, which again, it all enhances the symptomatic reduction of the patient's symptoms. In children, it can be utilized very easily, and it can actually be applied very simply to the mucosa and surrounding tissues by a cotton bud, you know, and it can be used again in patients who've had maybe teeth filed down for having crowns or bridges. It can be used as a sealer to enhance and reduce the sensitivity they get, but also as a mouthwash. It's very useful in patients who suffer from chronic sensitivity, because it actually blocks the little tubules that enter the pulp chamber and cause the symptoms the patient's facing. So you can see the application very simple around erupting tooth, anti-inflammatory, and again, analgesic, so really makes a large difference for patients. This is a case of pericoronitis, so you can again apply it locally, and you can see on the right-hand side how it sticks to the mucosa. You've got to be obviously careful not to get it all over, because it will stick, and again, we warn patients if they're using it themselves, and dentist training in this, not to get it on patients' clothes, because it's very difficult to remove. So again, it can be applied locally, and systemically, you know, you can advise the patients to take 3,000 to 5,000 milligrams daily to really boost up their immunity and build them up a bit. Again, in patients who have fungal infections, you know, this patient has oral candidosis from wearing the denture all day long. On the left-hand side, you can see the picture looks very red and raw. So they can, apart from using propolis, you can obviously advise them to keep the denture out, but application within the denture itself is very useful. And you can see this is healed up in a very, very short period of time. Again, lots of studies to prove and show all of this. Some clinical tips for clinicians out there. You know, obviously we check for the patient's allergy, but if you feel their immunity is low, start them on a high dose systemic propolis, you know, 3,000 to 5,000 milligrams, and then you can get them to tailor that off as a daily prevention, and very good use in soft tissue, routine soft tissue ulceration. And as one becomes more confident in its use, then obviously it can be used in more advanced cases in root canal therapy, in the treatment of periodontitis. And again, it's so useful orally because it actually sticks to the mucosa. So as a delivery system, you cannot beat it, because other oral gels, as I noted, they wash away, and whereas propolis stays there from hours on end to give a continued release and assistance for the patient. Now, just interestingly, I thought I'd throw in a bit about, because this is apitherapy, the use of honey. So an interesting study in the use of honey as an approach to alveolar osteitis. So this is usually an infection after the patient's had a tooth removed. You can see in the top right a very sort of red raw area. It's usually the bone has no useful blood clot and is very, very painful. This study showed how, you know, using honey in the actual dry socket causes obviously a reduction in inflammation, hyperemia, and also cleans up any exudate in the area. So very useful in such sort of cases of necrosis in the bone, and very useful for the patient to use, again, systemically, and can be applied by the dentist or surgeon topically into the actual area to help healing. Now, for further reading, you know, there is a study that myself, James, and my colleagues, Felix, our colleague who's presenting as well, and Dr. Rafael from Uruguay, Felix from Indonesia, and we talk about this in the Journal of Oral Biosciences. Very quite a comprehensive paper which talks about this in great detail. So in conclusion, you know, people worry about the legalities. Clinicians worry, what about this happens to the patient if they're allergic? Well, we do our best, but patients can buy a lot of these preparations themselves. So if they can buy them over the counter, then, you know, you advising them to use them is nothing untoward. And keeping this in your surgery system is very, very useful as well. And I think there's great use for the use of this in clinical practice, which me and James will be looking at further. And, you know, long run, pre and post-op treatment, extraction advice, surgery guidelines. I'm preparing myself to help the patients with the general immunity and nutritional advice, and potentially to be used in periodontal dressings and periodontal packs to assist patients who are suffering from chronic and acute periodontitis. So thank you for listening. I hope you've enjoyed that. And it was a very speedy run through how it works, but welcome to take questions, and obviously people welcome to email me and learn further, because there are colleagues around the globe like Rafael, who is an expert in this area as well. And we look forward to listening to him as well. Thank you for now.
Okay, so excellent presentation also from UK. We have 2 minutes more. What do you think about this presentation, Dr. Rafael first, because you are closer to dentistry? ¿Qué piensas? ¿Cómo fue?
Muy buena. Excellent presentation.
Excellent presentation, yes.
Really.
Yes. Very good. And the idea to make international cooperation is also very, very good. Yes. And Anna, what do you think?
James.
Yes. Now we have this scientific base of use of the products also for dentistry. What do you think?
It's very interesting for me also. I think that due to the international cooperation, we can share our knowledge and we can develop apitherapy also in dentistry. For me, it's a new topic, but thanks to Dr. Rafael Felitti, I do the first step in this direct.
Yes. And I have also in my own library in UK, they made a small booklet, like 1 page only for each disease in dentistry, and very, very synthetical, like ABC, and very interesting booklet. And then let's not forget that after this marathon, API marathon, we have a bit of break, but from 27 to 28, it's another conference, this time focused on propolis. It will be International Propolis Research Group. So also in this conference, we'll learn a lot about propolis, including the use for the oral health care. Thank you very, very much for your participation.